Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Islanders. We hope you enjoy this edition.
And welcome to Labor Vision, a production of the Institute for Labor Studies and Research. I'm your host, Erica Hammond, and joined with me today is Jill Sypole, a licensed clinical social worker, here to talk to us about the work that she's doing at Building Futures and a new training that they're working on around the opioid crisis in the construction industry and prevention. Thanks so much for joining us, Jill.
Nice to be here.
All right, let's start with Building Futures and some of the work that you're doing there. Can you tell us a little bit about it?
Sure. So, Building Futures is an agency that works to promote registered apprenticeship as a means to meet industry needs and a pathway to create family-sustaining careers for everyone in our community, really. So we do it kind of in two ways. One is we support a pre-apprenticeship program and support the apprenticeship model in the building trades, and then we're also expanding the apprenticeship model into other industries as well, such as IT and healthcare.
Okay, and can you tell us about the construction industry, why it's so special in a situation like this?
It's not new news that the opioid epidemic has hit the nation really hard, and the statistics of fatalities have risen over the years, and we're at a high point in 2017. And we've started to see an uptick in people within the construction industry using opioids and then becoming dependent on them. Last year, there was a study in Massachusetts that stated that it was a particularly high ratio of the overdose fatalities, and in August it was confirmed that that's the case in Rhode Island as well. So it's estimated that 1 in 5 of the overdose fatalities in about the last 2 years were people within the construction industry.
Okay. And I know you're about to roll out a new training around opioids in the construction industry, and can you tell us how you got to this process?
We had this idea of what an intervention could be to start to address and create a prevention program for specific to the construction industry. And so we got funding through the Department of Labor and Training, and we created curriculum throughout the last year or so, and we rolled it out to the Building Trades Council in May. Since then, we've revised it, created some hands-on elements, added Narcan training and naloxone training, and most recently had a focus group of people within the industry and in recovery to kind of run the training through, and now we're ready to roll it out.
It's exciting. Can you talk to us about some of the key points of this training?
Sure. It goes through 3 big pieces. The first is prevention and preventing opioid use disorder generally. And the next is what to do if you know someone's struggling, and I always call it how to help your buddy, and what are those initial steps, how to engage in that conversation.
Okay.
And then lastly, it's how to intervene in a medical crisis and do rescue training, which includes the Narcan training.
And can you give us some information on how you can help a person develop a prevention strategy?
We talk about prevention in a lot of ways. The first is just preventing injury or pain in the first place.
Right.
And in that way, we're talking about job site injury prevention, such as flex and stretch, and taking that really seriously. And also what kind of consistent prevention you could do at home. Like eating well, having great sleeping habits, exercise, core strengthening things, just to make sure you're not injured in the first place.
Right.
If you are seeking medical attention for pain or discomfort, how to talk to your doctor and how to have safe use if you are prescribed an opioid. And then sometimes opioid dependence can be created in a situation that's not just addressing physical pain. So we do add elements of taking care of your own mental wellness and some coping skills, and have a conversation about that as well.
Okay. That first point you made about just actively taking steps to be more safe on the workplace. You hit the nail on the head with one of the most important points of our health and safety training that we offer at the Institute for Labor Studies and Research. And we do that. That's one of the points, is talking about ergonomics and creating a safe work environment, and that importance of that, just to take those preventative steps, right, to stop something larger from becoming an issue.
Yeah, anecdotally, the thing I keep hearing during the trainings is from some of the older people that have gone through it is, oh, I didn't take the ergonomic stuff that seriously initially, and now I am.
Yeah, exactly.
So it's a good way to kind of remind them that's a way to reduce pain.
And that's some awesome information on preventative steps. What can you tell us about if you recognize someone is struggling for that person? What can you tell us?
Yeah, I think part of that conversation that's hard is that some people don't know exactly how to recognize the signs. That's a question I get a lot. So physically, the thing about opioids is that they suppress your breathing. And so physically, you might look for signs of somebody who has a little bit less oxygen if they're using them very frequently. So maybe a change in skin color or slowed breathing or kind of physical symptoms like that. But I think the bigger piece is, you know the people around you well. You know your community, you know your friends, you know your coworkers. If something feels off, trust your gut. And so I would say if something feels off, maybe it's substance use, maybe it's not, but at least have that initial conversation.
And what is one of the most important points about having that conversation? I know empathy is super important. Can you talk to us a little bit about making sure you're keeping that conversation open? How would you do that, or how would you kind of take a step in having that conversation to not make it like you're attacking that person or accusing them of something, especially if they're not at a stage where they're ready to talk about something like that?
Right. I think initially, or at least for the last handful of years, we've talked a lot about an intervention strategy and staging these interventions and really sitting people down and telling them about their deficits and what people around them are struggling with. And we really shift from that in this training to talking about ways to listen non-judgmentally and tell them that you can be a resource and that you're here for them and you want to support them, and really focusing on some of the positive behaviors that they've provided. Maybe if they were on time for work 2 days in a row, really making kind of a big deal out of that. And the reason is you're going to maintain this relationship while someone is struggling, right? So then they'll continue to see you as a resource and a place to go to.
And how would you change that conversation if right when you initially kind of open the door to the conversation and it's very clear that that person is not ready to seek recovery or not ready for your help or just simply doesn't want to talk? What are some steps that you would kind of change that conversation?
I think even just having an awareness that the conversation should change if that's the case. People are ready in their own time, and they also find recovery in their own ways. Not one path is the same for anyone. So I think just making sure that they know that when they're ready, you're there for them. And I think when you're struggling with someone's dependence, it's really easy to be frustrated by that. When they're not quite ready. So taking care of your own needs as well when you're kind of playing a caregiver role or trying to work with them. I think providing resources and just letting them be, and one of those resources could be yourself, right? Saying, I'm here for you. Whenever you're ready.
All right. I know you have some really great slides that we can probably pull up on the screen. So if you want to go over some of the slides for viewers, some resource slides.
Sure. So I did talk about the common signs of opioid dependence, and I just kind of generally said that it was a little bit, if you think about relation to lack of oxygen or less. So shallow breathing and extreme drowsiness, dry mouth, things like that. This also does talk a little bit about social isolation and pieces like that. So just physical things to look for. And I think a lot of those are ones that you would notice. Obviously there's low blood pressure on here as well, which
Right.
I'm not really checking the blood pressure of my friends.
Right.
But these are just, and they're not meant to be used to say, I'm going to accuse you of something, or
Right.
it's just to give you an indicator of when someone might be struggling and
Right.
when to initiate a conversation.
Right, the kind of the signs to make sure you're looking for if you have a sense someone might be struggling.
Yeah.
I know you have a slide on some resources, right?
Yes.
All right, so what would that slide?
So if you're having the conversation with somebody and they seem open to resources, I've outlined a few in my presentation,
Right.
and I actually call them cell phone resource cards because part of the presentation is that everybody has to take out their phone and take a picture of it. So they would take a picture of this Connect to Care resource card, and that gives you some of the best ways to connect to care directly. This BH link, the 401-414 link phone number, and there's a physical location in East Providence, is probably the only number you really need right now. It's a relatively new program that's had a lot of success, and it can serve as initial treatment place for mental health and substance use.
Okay.
And then the next one is a handful of free apps that I talk about, and the ones at the top are all about kind of coping skills and ways to work on meditation or maybe connect to online treatment. And then
Those are all cell phone apps?
yeah, they're free cell phone apps. And then some shift a little bit more to mental health, such as the PTSD specific one. And then the last three are all recovery specific apps.
Okay.
So I use those because they're great free resources, and many people do have access to a phone. And then the last piece is a list of alternative pain management resources, especially if you're starting to consider those options with your doctor. That's just a kind of overview of some of the options you might have.
All right. And for those of you who are watching, Jill just ran through a slide you're probably seeing up now on the screen, and she was covering those three boxes, the three cards, right? All right, so if you missed any of that, you can check it out again once we air this on our YouTube channel.
And part of the presentation is that, like I said, people do take pictures of it with their phone, and I've already anecdotally heard a few people say, oh, I actually did text my friend the resource card,
Right.
which is sort of the point.
You can send it.
So yeah,
it's easily
been
sent
great.
and shared. All right, and now kind of pivoting back a little bit to what we were talking about and recognizing someone who is struggling. I know personally that addiction and recovery is not the same for everyone. So can you cover a little bit about the importance of becoming a recovery-friendly support system? And I know you covered it already in that initial conversation, but what would that look like if you're trying to help someone, because recovery is different for everyone, right? So their support system, as a support system, your job is not to be taking that addiction from them or to be taking these steps for them or pushing them to take these steps, right?
Right.
So what does that support system look more like?
I think it's really helpful to look around and ask, but check the internet for what some tips are. But the best thing, honestly, is if you're working with somebody, just ask them what they want for support and what they need, and kind of navigating that and negotiating it. I do provide a list of just ways to support someone. A lot of, some people like the 12-step programs or peer programs, and a lot of them are open meetings, so you could actually join someone for a meeting or go to Al-Anon or Nar-Anon yourself to just learn of different ways to be supportive. I think what you touched upon is so important about being there for someone, but also knowing that it's not your burden to take on necessarily, and having that balance, and not someone who is struggling with dependence and struggling and working toward recovery may feel elements of a chaotic environment at times. And so whatever you can do to limit that and have yourself not take on that stress, but actually be a calming presence can really help.
Right.
And we talk a little bit about thinking about a recovery-friendly workplace or job site, or what are some things like, after work, going out for a drink is not super supportive to somebody who's
Right.
in recovery. So thinking about what some alternatives are, I usually say ice cream's the best. And so, just being really thoughtful about how it might be impacting people around you.
That made me think of, I know that in creating safe spaces for people so that they don't feel left out. This was a conversation we had with a group that I was with for a while, our Leadership for a Future group. And that was a conversation we had often, was we always wanted to do something as a group afterwards. We called it Homework Club. And the easiest thing was to offer, well, let's all go to a bar and hang out and talk. But for some individuals in the group, that may have prevented them from wanting to go with us to homework group, even though we weren't doing any homework. We were just kind of hanging out and talking through a lot of the things that we talked about in classes.
Right.
But it's keeping in mind that you have to be making sure that space is open for everyone, and it's not stopping people from taking part in things like that, right?
Yeah, absolutely. And I think even being intentional about when you are going out in an environment where there is a lot of drinking or something, even, being the person that's ordering the mocktail right along with them, or, kind of coming up with some creative alternative options.
Right. All right. And can you talk about some of the, I know that this training right now is not necessarily open to the public, but that may be in the future, as you alluded to. But how can viewers get involved with this, like a training like this, or for those of them who are in the trades, will this be offered to the trades? Like, can someone request a training, or how does that work?
Yeah, so we are rolling it out to the Building Trades Council this week, and then we will have we'll be working with the apprenticeship trainers and training through their apprenticeship classes, and all the way up the ranks within each union. So we're hoping to initially focus on the construction industry in that way. We've also adapted it to a youth audience, and I've presented it twice to Youth Build. And so we're working on different ways to disseminate it, for sure.
Right.
And so anybody could contact me at Building Futures, and we can talk about ways to present it. There are other opioid trainings for sure, and Rhode Island has a program where you can show up to any pharmacy and request Narcan or naloxone, and the pharmacist will train you on the spot.
Wow.
It takes a couple of minutes. It's not too long.
I didn't know that. That's just in Rhode Island?
Yep, there's a standing order for the prescription. So if anybody wants to have it, it would just go through your health insurance, and then you would pay your copay.
Right.
But if anybody wants to have it on them, then that's a way to do that, and that's really easy. That's probably one of the closest ways to do a quick training.
Are you familiar with the Providence Safe Stations?
Yeah, so it's on our resource cards list.
Okay.
So you can show up to Providence fire stations at any point, and kind of they'll help you connect to peer recovery coaches, and there's other cities and towns that are trying to replicate the model throughout the state as well.
Right.
So I like the idea of using the fire stations as a space, a safe haven for people, and they're being used well.
And I learned about that at one of the Lunch and Learn seminars that was put on, and I'm excited to see yours this week. I think it is, right? So that's exciting.
Yeah.
Now, are there any slides that you want to cover? We can pull them up on the screen. Any that we haven't covered that we can go over?
Yeah.
I know there's a lot of great ones on here.
I think talking about the tips for working with your doctor and safe use, and then maybe this one might be, the other ones are, although we didn't, like the actual risk factors of why.
Okay.
So I don't know what order that makes sense in.
Let's start with the risk factors that may contribute to opioid use. We'll start with that.
Okay.
All right. And then talking to your doctor, we'll go to there.
Perfect. So we've identified that it is a problem in the construction industry, and there's some risk factors that sort of lead to this opioid use dependence. Some of them are that the industry, you're more prone to injury. It's just a physical work. It's hard, it's tough, and so there is some pain and strain that might be involved in your work. And so working with your doctor, again, we talked about injury prevention. And then the other piece of this is it really does come down to economics. The industry is seasonal, and you have a lot of work in bursts of time, and you have to work those hours or you may not get them. So
until the next season, right?
Exactly.
So you can't miss that time of work.
It depends on when you have a job and when you don't. And when you're working a lot and often, and it's difficult to make doctor's appointments and difficult to maybe treat an injury or really let yourself rest in a way that would be great. So there's some economic stressors, and if you don't work, you don't get paid. There is some provisions for sick leave, but it's not a huge economic support right now. And then just expectations that it's the pace and environment of this industry is that we have to work hard and take pride in our work, but also do it well and quickly. So that pace doesn't necessarily lend itself to, again, kind of caring for an injury or coming back half time or things like that.
And you mentioned something earlier about the ergonomics when you were speaking with someone and they said, I really never took that seriously until now. When I was reading over some of the preventative steps you can do, stretching, like on a work site you can stretch, you can kind of warm up or get ready for the job that you're going to be doing, and that's not something that you think of, or I feel like a lot of individuals think that they should be doing on a work site, where that could be the difference between being out of work for X number of months, and it could make all the difference just stretching for 5 minutes or right.
And warming your body up, getting it prepared. It is such a physically demanding work, so it's like going to a marathon without stretching in some ways. So
we have to normalize that.
Right, and many job sites you come a few minutes early and everybody sort of does it together, which is great. Yeah, and then there's some pieces of culture, and there's a strong community that we're working to build on, the brotherhood and sisterhood within the unions, that people are so willing to work with each other and be supportive of each other, but they also may find it hard to ask for help. And it's hard to, you don't want to be seen as a weak link, or you don't want to be seen as somebody who's struggling when you want to be helping everybody else around you. So I think there's some elements of that too that we at least process as a group. There's small group discussion where people can really spend some time with chewing this stuff over and thinking about how to work within this.
Right. That made me think of you can't pour from an empty cup. So as much as you don't want to be a burden, or you don't want to show that you're struggling to your coworkers or family members or friends, it's just as important to make sure that you're getting the help that you need, so that you're not becoming a burden, or you're not a burden, but you're not taking yourself out of the work site, right?
Yeah, and you don't want to be creating any sort of safety concern either, right? And so people are trying to figure out ways to, we're trying to figure out ways to leverage that community element. And the other thing that's been really great during these presentations is that there's so many times when people are able to identify who is on the job site that's in recovery and that would love to support someone, so that's kind of good that it's sort of a casual knowledge that people know, which means that they're putting themselves out there as a support system.
Right. All right, let's pivot to talking with a doctor, talking through pain with your doctor. Yeah,
the thing about talking about pain is it can be actually pretty hard when you're in pain to describe it. So some of the tips that we go through are to be very descriptive. They actually say to use metaphors can be helpful, or imagery. And describing your day and where the pain is coming, what part of the day you're feeling it, but also what functions that you're able to do, or what functions are really impacted, can give your doctor a really more in-depth scope of how to address the pain. And then the biggest piece is sharing your treatment history, what's worked, what hasn't, what you're willing to do, and ask a lot of questions about potentially alternative pain management, or maybe ways to make an opioid treatment maybe a little shorter.
All right, so starting with being as descriptive as possible, going into not necessarily just when the pain started or just covering how bad the pain is, but covering when you feel the pain the most, or right?
Yeah, throughout your day, or is it waking you up at night, or is it just actually it's in the morning when I first get out of bed? Going through your schedule essentially.
Okay. All right, that's very helpful. Was there one other slide that you wanted to make sure we covered?
The important thing of this is we don't want to demonize opioid prescriptions. When you're working with a medical team, there's many times when an opioid for a short-term acute injury can be super helpful, and sometimes the only thing that can really manage someone's pain while they're seeking other care.
Right.
So we talk about safe use of those opioids, and some of it is that initial conversation with your doctor, making sure it's in line with your whole treatment history and that you understand the directions, ask questions. Knowing the risks are part of the training, of course, and then really understanding your treatment plan, how long you're expecting to be on an opioid and when you might shift down to a non-opioid pain management treatment. And in Rhode Island, not only is there a standing order at pharmacies, but you're actually co-prescribed. So if you're prescribed an opioid, you're also prescribed Narcan.
Really?
Yeah,
Okay.
so when you go to fill your prescription, you would get both.
Okay.
And, it would be great to have in the house at the same time.
Right.
And there is an element of people maybe misunderstanding the directions or forgetting and taking multiple doses, so making sure you have a really good system for marking when you take it or when you don't, especially if someone else is helping with your medications, making sure it's all written very clearly. Of course, take as prescribed, and the biggest thing is to not mix any opioid prescriptions with anything, making sure it's cleared with the pharmacy with whatever else you might be taking, especially alcohol. Mixing with alcohol can be extremely dangerous.
All right. I know you mentioned it's super important to make sure you're keeping track. You have a good method for keeping track of whether you've taken your prescription for the morning and for the night. And so making sure you have a system is very important, especially if you have been prescribed opioids for hopefully an acute injury, right?
Yeah.
All right, I know we're just about out of time, but is there anything that you want to make sure we cover before we wrap up?
Yeah, I guess the opioid epidemic is huge and it's impacting the construction industry significantly. But we do try to talk about substance use in general and alcohol. It's not just an opioid issue. So I think including all areas where people might be struggling with dependence and how to address them is really important. And I'm hoping that people will go through the training and have at least the initial first steps of how to address a concern and build some empathy for someone who is struggling.
Okay. Thank you so much for joining us. For our viewers who would like to check out more of the information that Jill's talked about, feel free to reach out to you at Building Futures, or if you are unable to get in touch with her, you can reach out to myself at the Institute for Labor Studies and Research, and I can get you to the right contact person. All right, well, thank you again for joining us. This has been super helpful. If you've missed any part of this segment, you can check out the entire video on our YouTube channel. It's Labor Vision TV 1. All right, so thank you so much. You're watching Labor Vision. Thank you for tuning in. We hope to see you back here next week. Thanks.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.